Hello, everyone, and welcome to Team TSI's training. Today, we've got a special industry topic and a special guest that will be providing that training. So, I want to thank each of you for joining us today. We're going to be focusing on the language assistance services. So, before we get started, just a couple housekeeping items. First, I'd like everyone to look at your GoToWebinar panel, and we want to make sure you can ask questions for us today and the team. So, you notice in that kind of grouping where it has number one, many of you can see the large GoToWebinar panel, but if for some reason yours is hidden, you may have to find the little blue flower at the very bottom of your screen. Then it will populate your GoToWebinar panel, and if it's small, then you simply click on the orange arrow and it populates that larger panel. Once you have the large panel, look for the questions line. And when you click on that arrow next to the question line, it's going to look very similar to our second screenshot here in the number 2 section. So you're going to type a question where it says enter a question for staff. You'll click send, and your question will appear up in that question pane. And that's when the team that's with us today will be seeing those questions, will be monitoring and either answering those questions real time via text. So you'll see that information pop right back up in that question pane, or we'll save it for the end of the training. So another thing that I want to share with you is the handouts. Now, Hugh, our guest speaker today, is absolutely going to be addressing the handouts, and he's created some very valuable handouts for you. But you're just going to simply find the handouts on the GoToWebinar panel, click on the arrow next to handouts. You have 3 different handouts loaded. They are labeled number 1, number 8, and then an LEP presentation slide, which has handouts 2 through 7. So you will have a total of 8 items that he will be addressing. So that's really exciting, and want to make sure you can get those. If for some reason you can't get the handouts, please send us a little question and let us know, and we'll make sure we email them over to you so you can have those available. So now I really am excited to have a number of the team on the line, but if you have not attended one of these sessions, Hugh Heaton is one of our experts and works very closely with our subject matter experts, and he's really one of the benefits of a lot of the special process and procedure guides that we have in the online regulatory and compliance library, and he does a lot of wonderful things for Team TSI, and many of you are familiar with even the Heaton publications that he did years ago. So we're so excited to have Hugh with us, a part of our team, and also providing these wonderful trainings like you're going to have right now. You'll also notice that the support team is they're ready on the screen with support@teamtsi.com for any needs that you may have. And there's a number of us on the line today that will be helping and answering your questions. So with that, Hugh, thank you so much for providing this wonderful training, and I'm going to turn it over to you.
Thank you, Dahlia. Thank you, team. We are excited to be with you today, bring you something totally different than what we have been listening to for the past several months on regulatory compliance, especially with the COVID-19. So this session today deals with, I just lost my slide. Okay. What we're going to be looking at primarily is the language assistance program. So our objectives is to discuss the final rule, determine the entities that are required to provide the LEP services, and that will be very important for us. Define LEP, what does that mean? Who is involved in that? Discuss the 4 factors that determines the extent of the facility's obligations. Those 4 factors are critical to the facility's compliance goals and objectives, and we'll discuss each one of those in detail. Identify the 2 predominant ways to provide language assistance services. Discuss the use of interpreters, translation of vital documents, and describe the use of safe harbor to support compliance. And we'll touch on safe harbor and what that does for the LEP requirement. And then we will discuss the purpose and use of notice and taglines. This is a lot of information to look at. And Dahlia mentioned the handouts. Preparing for your determining your compliance level will require some work. But I think as we look through the process and we go through the handouts, I think you will find that they will provide you with some beneficial information that may help ease the burden on trying to comply with so many different regulations. So on June 19th of this year, the Department of Human Services published a final rule that deals with Section 1557 of the Affordable Care Act. And that rule deals with discrimination. We've all dealt with these particular regulatory requirements for years. There's nothing new with these other than that this final rule protects individuals with disabilities. It protects individuals with limited English proficiency, and it does require assurance of compliance. Now, when we looked at these regulations that we're going to look at do not change any current regulations governing Title VI, Section 504, age discrimination, sex discrimination. It doesn't change any of those. What this particular rule did, this rule has been in effect since 2016, and you're probably familiar with some of the requirements. If you have received any type of correspondence from Medicare or Medicaid, from your insurance provider, from pharmacists, from anyone who has provided you with any type of information relative to a particular benefit that you are eligible for, you have received in that communication a document that has numerous languages. They're called taglines. And you had to do that for every time you sent correspondence out. You got that. I get those every month from insurance companies, and they're all saying the same thing. They all have the 15 languages. Some have 18 to 20 different languages. What this rule does is eliminate that requirement. Now, it doesn't eliminate the taglines. It eliminates the 15 different languages that you had to provide. Whether you came into contact with those or not, you had to provide that. So this regulation has been modified to reduce the burden that facilities have to do, especially the paperwork version. Still have to comply, but not provide the amount of paperwork that you've had to do. So who is covered? Any entity that receives any federal financial assistance, such as Medicare Parts A, C, and D, must take reasonable steps to provide meaningful access to your programs for persons with limited English proficiency. That applies to doctor's office, dental offices, your pharmacist, your home health, hospice, any entity that receives any type of federal financial assistance has to comply with this rule. This is not just a nursing home only rule. And that's going to be beneficial to us as we go through some of this and maybe working together with the community. Eligible individuals must be able to access the full spectrum of services provided by your facility. And the language program needs to be tailored to your individual organization. And as we go through the process, you will see that that it will be individual because of the four factors that we will be looking at. The other part of this is that the LEP program has to be provided to individuals at no cost. So there will be it has to be provided free of charge, and your notices will have to include that. So what is LEP? Individuals who do not speak English as their primary language and who have a limited ability to read, speak, write, or understand English can be limited English proficient, or LEP. These individuals may be entitled to language assistance with respect to a particular type of service or benefit. This is old data. The 2010 census shows that 37.5 million individuals spoke Spanish. 10.3 speak other Indo-European languages, and 8.3 speak Asian or Pacific Island languages at home. That's important in this regulatory process. This is 10-year-old data, so we know that this information has changed, but that's the most current information we have on the census. Our community makeup culture is changing, and that's the reason for a lot of these particular regulatory requirements. If these individuals have limited ability to read, write, speak, or understand English, they are considered an LEP individual. So getting started, how do I get started with this? First thing you do, you are required to take reasonable steps to ensure meaningful access. So one of the requirements is that the reasonableness standard is intended to be flexible and fact-dependent, and the four factors will really explain that. It's also intended to balance the need to ensure access to critical services while not imposing undue financial burdens on the facility. That's very important. While designed to be flexible and fact-dependent, the starting point is an individualized assessment that balances these four factors. In the 2016 requirement, everyone had to provide the information on their 15 most common languages spoken in that state. And that was an excessive amount of financial hardship on small facilities who didn't encounter a lot of LEP individuals. So this standard has changed that, and it balances four factors. So let's look at those four factors. Factor number one, this is where your program must start. Determine the number or proportion of LEP persons eligible to be served or likely to be encountered by the services provided by the facility. So how do we do that? That's the first step. Who's eligible? What are the number of persons that may be included? So in determining what languages services, what's the number or proportion from a particular language or group served or encountered in your service area? The service area is a important factor. It's not just your community. It's not just your town or the city that you live in. It is the service area in which you provide services to residents. How many different areas does your residents come from? If you provide services in multiple areas, that's where your service group is. So when it talks about determining the number that you're likely to encounter, it's your entire service area. So the greater the number or the proportion is, the more likely that language services are needed. One of the handouts that we will look at shortly is handout number 5, which is a self-assessment checklist that will help you determine what languages, how often do I encounter those languages. But the focus of the analysis or the focus of the assessment is on the lack of English proficiency, not the ability to speak more than one language. What the rules talk about is that the ability to speak more than one language does not mean that one can read, speak, write, or understand the English language. So the critical factor in this assessment is their lack of English proficiency. So that's the key factor. Handout number 4 that we'll look at is your top 15 languages spoken by state. So it's going to provide you with some information to help you determine the number, but that's the first factor that we have to look at. So when you're looking at this particular analysis, what are some of the things that you need to look at? Examine your prior experience with LEP encounters. Identify the breadth and scope of language services that were needed. Have you had these encounters in the past? If so, how did you handle that? How many did you deal with? What did you have to provide in order to help that individual understand the information that was being provided? Identify and include language minority populations that are eligible but may be underserved because of existing language barriers. So you may want to look at, do I have a small population and they're not being served because of a language barrier? So other things that you can look at to gather information about validating your prior experience or looking at the number of individuals that your area serves. Collect and analyze these additional data. What's the latest census data for the area you serve? Get data from school systems. They have a tremendous amount of information about the type of students, their background, what language they speak, how do they serve these students. So they will have a great deal of information about the population and how often they encounter those systems. Data from community or religious organizations. Tremendous information from those organizations. LEP.gov, that is a tremendous website. When you go to that website, on the home page, you will find a tremendous amount of information about, there are maps, there are different language maps. One of them is, we have downloaded that and we'll look at that. But they also have some great video training material. So that's I would recommend that you start with that particular site and look at that. And data from local and state governments that will help you determine and meeting factor number 1. So factor number 2, determine the frequency with which LEP persons come into contact with your services or organization. How often do you have contact with LEP individuals? So we have number 1. We've determined that what our numbers are, and we've determined what the language groups are. Now we have to look at what's the frequency. The rule talks about assess as accurately as possible the frequency with which you have, or the potential to have, and that's a key word. That's a difficult word to comply with. Is if I were doing this, I always have the potential to do anything. So they're looking at what's the frequency and the possibility from different language groups seeking assistance. We're not looking at just at how many people speak different languages or a language other than English. What are those language groups? How many speak Spanish? How many Vietnamese, Korean, or other languages? Those are language groups. Consider the frequency of different types of language contacts. How often do I have contact with these different languages? The steps that are reasonable for a facility that serves on a limited basis will be totally different than those facilities who have contact or who serve LEP individuals on a daily or weekly basis. Rural areas may be on a very limited basis. So what they're looking for is the frequency, and getting that information from your local school systems will be very, very helpful to you. The more frequent the contact with a particular language, the more likely enhanced language services in that language are needed. So we'll need to consider the frequency of different types of language contacts. So frequent contact may indicate a special need. Less frequent contact with different language groups suggests different. So all of it is going to be based on what did I learn in factor number one? What have I learned in factor number two? Factor number three, determine the nature and the importance of the program. How important are the programs that you provide? You'll have to look at that. Determine what type of services your facility provides. Do you provide skilled nursing services, specialized rehabilitative services, daycare? Do you provide home health, hospice, other different types of services? So what's the nature and importance of the program? The more important the facility's activity, information, or services, the greater the possible consequences of the contact to the LEP individuals. If you're in a rural area or a major metropolitan area, these will be different requirements for you. So what is the nature of the service that you're providing, and how is important is it in the community that you serve? Determine whether denial or delay of access to services or information could have serious implications to the LEP individual. So that's what type of information am I providing? How important is that? You should consider the importance and urgency of its programs or activities. If the service is both important and urgent, the more likely that immediate language services are needed. Immediate means that it's provided immediately. There's not a lot of wiggle room there. How urgent is the care that you are providing, or a particular procedure that you're doing, and that you need to explain that. So how important is the process? For example, communication of critical information concerning an admission. So how important is that to the process? Is it urgent that you have that type of information? A discharge to the hospital, important communication, a significant change in medical conditions or treatments, the obtaining of informed consent to permit a procedure, etc. For example, an advance directive that's considered would be considered a very important and urgent need. If the service is important but not urgent, it is more likely that language services are needed, but that such services can be delayed for a reasonable period of time in order to obtain an interpreter. So if it's important, but it's not life-threatening, or it's not going to cause serious harm, and as you handout number 2 provides, it's the regulatory, it's the Federal Register. In that document, they go into great detail on explaining a lot of this information, and I encourage you to look at that. And in the handouts, you have these slides, and you have the notes that I'm using, and it will provide information in the notes about where in the regulations to go to as well. So you may want to look at the note pages on these particular slides, because they will get you to the right regulatory section. These types of situations may include activities such as the communication of information about administrative matters, or communication of information regarding admission where delay would not affect the resident's health. If an activity is neither important nor urgent, such as a tour of the facility, request for admission information, these are not likely important or urgent. So you'll have to look at what you consider to be important and urgent information in factor number 3. So what about factor number 4? Determine the resources available to you and the cost. So we've looked at how many different language groups will I encounter, how often, how important is my service, and now the resources available to me and the cost. Because remember, you have to provide this information to your clients at no cost. So your level of resources available and the cost imposed may have an impact on the nature of the steps that should be taken. I want to caution here that the fact that you say, well, I don't have the money to do this, does not eliminate your having to comply with the rule. That's not what this is about. Because as we look further, there are some, in the regulatory requirements, they offer some information about working with the community. Reasonable steps may cease to be reasonable where the cost imposed substantially exceeds the benefits. For example, you're a rural community or a metropolitan area where you only have 1 or 2 cases. Would it be reasonable? What would the cost be for me to comply with the rule? And so I have to evaluate what the reasonable steps are. And I think the key word to that is it's reasonable. You must carefully explore the most cost-effective means of delivering competent and accurate language services before limiting services due to resource concerns. So you can't just not do it. You have to look at the particular resources that's available to me. So in looking at some of those resources that's available to me, what are they? Utilizing advances in technology. Are they computer programs? Are there systems in place that can help me help that individual understand the language or understand the document or the services that I'm providing? Sharing language assistance materials and services among and between other facilities and advocacy groups. Video interpretation services. Going back to one of the first 5 slides that we looked at, it talked about who is covered. So you, in your community, you have physician offices, dental offices, health departments, schools, pharmacists, other entities that you can share some of these costs. And that's what it's talking about, working with different groups collectively, because you're all doing the same thing, training bilingual staff to act as interpreters and translators. You may have some people in your facility that already speak more than one language. It's training them to be interpreters and translators. Now, there's requirements on what their qualifications can be. Pooling resources and standardizing documents to reduce translation needs, and we'll look at that because there's documents that you will have to consider as vital documents. And using qualified community volunteers. Maybe you have access to a community college or a college near you, or maybe your high school has a language program that can provide you with interpreters or someone that can translate a document. There are many computer programs that translate. The problem that you will encounter with some of those is going to be, do they translate medical terminology accurately? And that's one of the problems we'll have with just using any volunteer or any interpreter is, do they understand the document that they are translating for that individual? So ways to provide. Now we've gone through the 4 steps. Now we have to look at, how do I provide that services? There's 2 predominant ways. They are oral interpretation and written translation. It's only 2 ways you can do this. You must provide competent interpreters in a timely manner. The word competent doesn't mean that they have to be certified. In the rules, it doesn't talk about that a person has to be a certified interpreter. It doesn't require that. That they have to be competent in understanding the language and the culture background that they are interpreting. That they understand that it has to be done timely. One clear guide for timeliness is that the facility must provide the language assistance at a time and a place that does not cause a denial, a delay, or any type of undue burden on the individual's rights. So that is ways that we provide language services. So how about using interpreters? They provide verbal interpretation, and they may be dedicated staff members. You may have some great staff members who are highly qualified to do this. Contracted interpreters, that's a cost, but here again, it may be a cost that can be shared with other providers in the community, where if you've got a special language group that you're have identified in your assessment, everyone who is in the community that's providing the service, receiving federal funds, has the same group. So it may be that you can share the expenses. Qualified bilingual staff. Telephonic or video remote interpreters. We know that COVID-19 has prompted the use of telemedicine. We've used our computer to do virtual visitation. So we're seeing that there is a lot of different types of equipment that's available that you already have in your facility. Community volunteers. The rules are really tough on bilingual family members who are not well equipped to interpret. They really discourage using family members unless you know that they actually understand the medical language that you're trying to convey to the client. The use of a minor child is not permitted unless it is an emergency involving imminent threat to the safety or well-being of the individual, and there is no qualified interpreter immediately available. The use of a minor child is strictly prohibited with the exception of this requirement. So they do not want you to use, and mainly because the children do not have the ability to comprehend a lot of the regulatory or medical terminology that our profession uses. So written translations. The translation is the replacement of a written text from one language, the source language, into an equivalent written text in another language or the target language. This is a critical component of the regulation. The facility should identify which documents are vital documents or those that contain information that is critical for obtaining services they seek. You will need to do that as quickly as you possibly can. This rule went into effect August the 18th. So it's in effect today. What are the vital documents that I will need to have translated? And whether or not a document is a vital may depend upon the importance of the program. So how important is the document to the program? And the consequence to the person, to the LEP person, if the information in question is not provided accurately or in a timely manner. In the previous rules, we had to translate everything, but we don't have to do that now. We only have to identify what our vital documents are. It's important that documents are translated accurately to ensure that the LEP individual can understand the content. And that's what I was talking about earlier. You can use computer programs to translate. What we have to be careful about is, do they translate it accurately? And so what the Office of Civil Rights, should they survey, that's what they're going to look for, is how do you know that the information is translated accurately? Vital documents, and this is just a listing. It's certainly not inclusive of some of the documents that you would look at. Admission forms. Are those admission forms critical? Is that a vital document? Consent forms. What type of consent forms do you use? It may not be that you would need to translate all of them, but are there some that's absolutely necessary to be translated? And in what language do I translate them in? It always goes back to factor number one. How about complaints and grievance forms? The rule requires a complaint and grievance policy or process. You already have that in place. If you have already developed policies and procedures for Section 504 or Title VI or age or sex discrimination, you already have this in process. The only thing that you would need to do, and I would recommend, is go into that policy or that notice, whatever you have, and just add language assistance program. It's the only thing you need to add, because you have already met the complaint and grievance process, because you already are following Title VI and Section 504 and other notices. You already have those. Financial payment policies. Are those critical to be translated? Rights and responsibilities. Medical and treatment instructions. Discharge summaries, and we do a lot of those, and advanced directives. So that's just some that we would look at. You may have others. Another thing that you would look at is, do you have a sister facility that you use similar material, that maybe you could take a lot of these written translations and use them collectively and share the cost and the time involved in translating these documents into the different languages? Maybe one could, and even in your community, where one could pay for a particular document, another one could pay for another one, and that way you could share the expense in doing all of this. I mentioned safe harbor. This is a, a rule that was placed in the requirements that the Office of Civil Rights. A question was asked: the following actions will be considered strong evidence of compliance with the facility's written translation obligations. So what CMS came up with, or the Office of Civil Rights came up with, is this particular requirement. How can I prove that I'm in compliance? The facility provides written translations of vital documents for each eligible group. Notice not individual, but language group that constitutes 5% or 1,000, whichever is less, of the populations of the persons eligible to be served or likely to be affected or encountered. So when you look at factor number one and you determine what my percent is, it's whichever one of these is the smallest. And all they're saying is, if you can prove that you are doing that, then we will take that as proof of your being in compliance with the program. If there are fewer than 50 persons in a language group that reaches the 5% trigger, the facility does not translate vital written materials, but provides written notice in the primary language of the LEP individual group to receive competent oral interpretation. So if you've got you're in an area where you have less than 50 persons, you may not be required to provide written translations of all of your vital documents. You would meet the fewer than 50 persons, and you provide in their language a notice that you will provide oral interpretation of the written materials free of cost. But Safe Harbors applies only to the translation of written documents. It does not apply to your oral requirements or factors 1, 2, 3, and 4. Safe Harbor does not affect the requirement to provide meaningful access through competent oral interpreters, where an application of the 4-factor test leads to determination that oral language services are needed and are reasonable. So it's not doing away with the requirements. Oral interpretation of documents may not substitute for translation of vital written documents. For example, other than the 50 or less rule. For example, oral interpretation of the resident's rights and responsibilities may not substitute for a written translation of a document containing the rights and the consequences of violating the rights and responsibilities. Because we have resident rights, but we also have part of the resident's rights is the resident's responsibilities to comply with that. So Safe Harbor does not just necessarily eliminate our requirement to provide vital written documents. So now that we have determined all of these other things, how do we identify LEP individuals who need language assistance? The first 2 factors of the 4-factor analysis require an assessment of the number or proportion and the frequency. This requires the facility to identify persons with whom you have contact. So here are some of the things that we can look at. Consider using a language communication cards or I Speak cards, and you've all seen those. One of the handouts that we have, handout number 6, is a I Speak card, and it will provide, you could actually print that card out if you want to, and to where a particular client comes in or a family member comes in, and they can point to that particular language. If available, Use language information and records of past interactions with residents, representatives, family members, and members of the public. One of the places that you can look at in past history, even in your current records, look at section A1100 of the MDS, because that question asks, do you need an interpreter? And what is your preferred language? In version 18, which will come out in a couple of years, it's out, but it's not going to be enforced. That particular those questions are reversed. They are asking what your preferred language is first, and then if you need an interpreter. But you could look at your MDS data. What previous languages have we worked with? Have we encountered, especially from the MDS? So that will provide you with some information. Consider posting notices in commonly encountered languages. That you provide the language services, it's available to them, and it's available without any cost to them. So identifying language assistance measures. An effective policy includes information about the ways in which language assistance will be provided. So how are you going to provide? In your policy, it must have information about how you're going to provide notice or information about your program. When identifying language assistance measures, the following information should be considered. The type of language services available. What do you offer in your facility? Do you offer bilingual staff? Do you offer telephone or video conferencing? What type of language assistance services do you provide? And how can staff obtain these services? How do they get access to them? I guess one of the critical things that you would have to look at in your policy development or in your program development is points of contact. Where in the facility will the first contact be? Will it be on the telephone? Will it be at the reception desk? Will it be at the business office? Where is the first point of contact that you would have for a language individual that would need language assistance? And develop your program based on that. So how would the staff obtain access to them? And how does the staff respond? How to respond to written communication, and how to respond to individuals who have in-person contact with your staff. So your policies and procedures are going to address these. And how to ensure competency of interpreters and translation services. How will the facility verify that? How will they ensure that the information is being translated accurately? The next thing that you have to do that the rules require is staff training. It's the responsibility of the facility to ensure that staff know their obligations to provide meaningful access. Meaningful access means that it's not just a cursory review, that you are going to answer their questions, you're going to provide the information that you need. Facilities training program should ensure that the staff know about the policies and procedures, and the staff that have contact with the public are trained to work with the person, whether it's in person or whether it's on telephone. So your training program has to address that. The other thing that we look at quickly is notices. Even in the previous version, we had all of these notices that we had to provide. But under this one, once a determination has been made on the language services that will be provided, you should consider these things: posting signs in appropriate languages in lobbies, admission and business offices. Where am I going to post these signs? You're not going to have to post the 15 different languages. What you want to look at is from your factor number 1 and factor number 2, how many languages do we encounter? And we look at that information. And that's the different types of languages and where you post them, uh, the different notices. One of the things that we talked about earlier was notices. You're not really going to have to create a new notice. If you are in compliance with your Title VI and your Section 504 notices, just like the grievance and complaints, you have a discrimination notice already developed. Just add language assistance terminology to that. Don't create a new one. Just add that. So your notices will be easy. Or stating documents such as brochures, your booklets. If you have a website, do you have on your website what languages you support, what languages you provide assistance in? If you have a website, I would, especially on the homepage, I would certainly encourage you to take a look at adding that piece of information to your website. Using a telephone voicemail menu in the most common languages encountered. You hear that all the time. We'll call someone if you need it in English, press this, Spanish, this, other different languages. So you may can use that as a particular notice, and certainly putting notices in newspapers. We've done that for years, other than English. Taglines. We've talked about taglines. You've seen those when you get mail from your insurance carriers, anyone providing you with healthcare information, they put those taglines in there. And all that tagline is just to inform individuals about the availability of language service. And here's a tagline written in Spanish. But this is translated. If you speak Spanish, language assistance services are available free of charge. That tagline has to be available in every language in which you encounter, from factor number one and factor number two. So if you've got 5 different languages that you encounter, you will need to have that tagline, which goes in your notices. It can go on your website, just different locations. One of the last things we want to look at is monitoring and updating your plan. You need to do this every year, at least annually. Another thing that you will have to look at is if you change your vital documents, say you change your admission process or your financial agreement, then you're going to have to update that information, have it translated as well. So when changes in services occur, you will have to, what type of notices do I provide? So you also ensure that you have a complaint grievance procedure in place and that you have a QAPI monitoring process. This falls under your QAPI program. One of the things that you may want to look at, I know you don't want to do this, but it may be something that I would certainly consider, is appointing someone to be your language access coordinator, someone in the facility that can answer the questions, someone who can direct individuals to services that they need, interpretive services, written documents, someone who can, and probably someone in the admission or business office would be great at doing that. Before we get into the questions, I do want to just quickly run through the handouts. You have in your handouts these are the slides. Your handouts are group 2 through 7. Handout number 1 is I'll show you that very quickly. I don't guess I will. Sorry. Handout number 1 is just your participant session outline, but this particular document contains all of the notes that I use. As you go through it, you will see all of the different, and by the way, they are bookmarked. So when you're looking at this, it's going to tell you which handout to look at that will provide you with information. It's the same data that I was looking at. Handout number 2 is the regulations. Handout number 3, this is a set of policies and procedures. You may not have policies yet. If you don't, you can use this particular template that will help you. Handout number 4 is the top 15 languages spoken by state. This is current as of August 2016. They are listed, so if you're in Colorado, you can just it's bookmarked by state. You can find the information quickly. But this one is something I wanted you to look at. This is for doing step number 1, we created an assessment checklist. It's all digital, so you'll be able to quickly go through, do it directly on your computer. It won't take long to do that, and then you will know how to do steps number 2 through 4. Handout number 6 is your identification, your I Speak card. One can just point to the language. That's maybe where your language access coordinator, or especially your point of contact. These are your TTY access if you need those by state. But I want to show you handout number 8. When you're talking about, and this information comes directly from the lep.gov website. We just downloaded it and we reformatted it and put the filter so you can sort by any column. But this is by state, by county. So if I want to look for another state, I deselect that and say I want to look for Florida. It will automatically list the state by county. That county will tell us what our population groups are. So handout number 8 is an Excel spreadsheet that contains a ton of information. I encourage you to look at that. So if there's any questions or answers or any questions, I'll try to answer them. I know we did a lot in a short period of time, but your handouts will provide and fill in a lot of blanks for you. I promise it will. So Dahlia?
Wonderful. Thank you, Hugh. That was great. I am looking at the questions, and it does not appear that there's any unanswered questions, so we are good to go.
Okay.
We didn't have anyone that wasn't able to download those handouts either. So remember, everyone, there are 3 different handouts available inside the GoToWebinar panel. One handout says LEP presentation slides, and that has 2 through 7, and he was just showing that a moment ago. So just wanted to clarify that. If there's anyone that has any additional questions after you're going through the handouts, or if you'd like the recording, please reach out to training@teamtsi.com or support@teamtsi.com, and we'd be happy to get you whatever you need. So thank you, Hugh.
Thank you, and I want to just end by telling the participants we really appreciate, I appreciate what you are doing for your community, for your residents, and for your families. Thank you very much.
Thank you, Hugh. Thank you, everyone, for joining us. That concludes our webinar. Bye, everyone.